is about building capacity of healthcare workers in 3 primary healthcare centers in Ibeju, Lekki local government area. Our choice of primary healthcare center in particular is for 2 reasons. Number one is the fact that these primary health centers operate 24 hours to provide maternal and child health services for the women in this community. They are the closest to the local community people. The 5 moments of hand hygiene, number one is before you touch a patient, before you perform any procedure, and then after you get exposed to body fluids, and then after touching a patient, and then after you touch anything around the patient's area, you're supposed to observe hand hygiene. So those are the 5 moments of hand hygiene in a healthcare setting. Can maybe 1 or 2 of us share moments of hand hygiene from your experience, from your role as a healthcare worker?
Like last week was when I was getting the vital check for an elderly man. He vomited when I was trying to get his vital signs. So after that, I had to quickly go and wash my hands while they cleaned up from it.
Okay, going forward, if I'm to assist the doctor or any nurse in carrying out any procedure, I will always encourage them or remind them to wash their hand properly. Even me myself, if I'm to do anything, I will make sure I wash my hand properly before and after any procedure.
I learned how to properly wash my hands using steps, the song, and then I also learned the 5 moments of washing my hands, and also how to keep the importance of having a clean environment in a health organization.
The innovative thing we do here to promote hand hygiene is one that we have constant water running, and we have a place where everyone can have access to that running water. And so we encourage our patients, even by health education, to partake in hand hygiene because we know the importance. Most times we don't have hand sanitizers. Even the buckets, we have the Veronica buckets. Most of them since that 2015 had gone bad. And if they come in with such help, it will be appreciated. Sanitizers, the Veronica buckets, even disposable towels, even the training. Like today, they are having training with us. It's fantastic. Even our patients are enjoying it. It's of very much help. Partners like DRASA can help us in so many areas as long as it pertains to hand hygiene.
This training was inspired because of recent developments in the world healthcare system as a result of infectious disease outbreak that were recorded recently, like COVID-19 pandemic, which actually revealed a lot of weaknesses in our healthcare system. And one of which is the lack of proper infection prevention and control practices, which has led to increasing incidences of healthcare-associated infection among health workers and also the patients that walk into our health facilities to receive care. Six areas, 6 palm to palm, back of the palm, in between the fingers, correct, your thumb, your knuckles, and then your fingertips. These are the 6 most important area of your hand that you must wash before you can see that your hands are very clean.
I was one of the volunteers at the for the hand washing demonstration. So I performed the hand washing procedure, but I was corrected later on that, okay, I'm supposed to wash in between my fingers. I forgot to wash my thumb, the side of my hand. So, and I was corrected on that. I can now say I know about the 6 important areas not to forget during hand washing procedure.
Dédé náà rán mi sọ fún wa tẹ́lẹ̀ pé ká bá ti fẹ́ ṣiṣẹ́, àbí ká bá fẹ́ gbálẹ̀, ká kọ́kọ́ fọwọ́ wa. After a bá ṣe cleaner tán, ká tó fọwọ́ wa. Gbogbo náà rán mi sọ fún wa pé ká máa lò nose cover, ká dẹ̀ máa fọ ọwọ́ wa dáadáa.
We make sure everybody that is going in or coming out of the PHC are mandated to wash their hands. So we have provided hand washing plastic all over our PHCs that we can use. Partners like DRASA can support us, number one, with the one they have done, the training that we have had already. Then they can support us by providing more plastics hand washing plastics, or they can also support us by helping us getting running water.
So at the end of this training, I hope to see where our primary healthcare centers have people that are empowered with knowledge of proper hand washing and infection prevention and control practices. I hope to see leaders emerging from our primary healthcare centers. When I say leaders, I mean hand hygiene and IPC champions, people who are actively and consciously promoting hand hygiene practices.
Sanitize your hand just like we thought, the 6 important areas, right? So you do that very fast. Like my colleague Moyosori said, if it's wet, it can easily get dry. So you make sure you sanitize your hand properly. And after doing that, you can go on to put on your gloves. Then when you discard, you go back again. See that you wash or you do what? You sanitize.
I've learned a lot of new things, but the highlight of the new thing I've learned is that when you want to clean maybe a patient's bed, you start from the top to the bottom. I thought probably the cleaning is just going to be a random thing, but I just learned newly now that there's a sequence to cleaning.
We promote hand hygiene within our patients and the entire health workers. We do educate them on hand hygiene, especially this time that we have cholera outbreak. We always tell them that we demonstrate how they can wash their hands.